Hello and welcome back to another Sunday setup for success, my weekly podcast where I try to set you up for a successful week ahead. My name is Felix Becker and I am the broke surgeon, success coach and founder of SuccessWerk. Now, you probably know that I've been running a survey of healthcare professionals over the last couple of weeks, trying to figure out what the real numbers are on burnout, what the data is behind burnout, trying to get opinions, truly subjective opinions on burnout in the medical field. And I have the results right here, and I want to share them with you today to give you the insights that you have shared with me. Now, you know, I've also put together a medical career coaching pathway. There's several coaching packages available for doctors, for trainees, right? Whether you're a resident or fellow, medical students even, to try to set you up for a successful career, a career that's filled with meaning and fulfillment so that we can hopefully avoid burnout in the long run, right? It's still true that almost 2/3 of healthcare professionals are burned out. And this is data from just last year, so this is hot off the press. This is real time, right? So many healthcare professionals are wanting to leave. Hundreds of thousands have left, and hundreds of thousands more are projected to leave the healthcare professions at a time when we have an aging population, a population that's less healthy than before, right? We have sicker people, we have more sicker people, and we have healthcare professionals leaving the field, meaning access to good quality care is even more difficult to find than it already is. And it's only going to get worse. And so what I was trying to do with this survey was figuring out what your thoughts are, right? What your opinions are, what your experiences with all of this, to see what can be done to change that. So this is let me pull this up. So what I have done here is I surveyed anybody who wanted to take the survey. The survey is still up. If you want to do that, you get a free copy of the Phoenix textbook as my token of gratitude for you to take the survey. So that's up on the website. And I'll continue to collect data because this is just fascinating stuff in my mind. So what I have so far is, of all the people that have submitted the survey, about 2/3 actually were physicians. 13% said they were in the nursing field, and the rest, about 20%, were other. There was one patient, administrators, nursing assistants, people who were involved with the healthcare field, but not directly associated with the provision, right? Providing healthcare to patients. They're more on the receiving side or on the administrative side. So if you look at the data that you guys shared with me, of the physicians that responded to the survey, 90% reported having some personal experience with burnout. 90% of physicians who took the survey. Now, granted, this survey was on burnout, so there's probably some higher propensity for people who are burned out to provide their feedback. But this data is very much in line with the data that's out there from much larger surveys, right? So if you look at the 2022 data, 64% of physicians reported burnout. Mine here are at 90%. Again, I think this data is a little bit skewed in towards burnout, only because the people who are burned out probably feel more compelled to participate in the survey, to participate for change, to look for solutions. Of the nurses, 75% reported burnout, right? And actually 100% of the administrators and patients reported some personal experience with burnout, which is quite fascinating to me, actually, is that even on the administrative side, people are frustrated with the system that we currently have. And so one of the first questions that I asked was simply, how do you take care of yourself, right? What do you do for yourself? Because as healthcare providers, we're really good at taking care of others, but we're absolutely terrible at taking care of ourselves. And so I wanted to know, what do people do for self-care, right? What do you do for yourself that doesn't involve taking care of someone else? And the answers really are as varied as human nature, and that is as beautiful, right? I mean, the stuff that you guys said you're doing for self-care is really all over the place. One person just said hobbies, which is a very broad category, but if you look at the rest of it, I mean, exercise, meditation, playing music, listening to music, video games, traveling, interacting with pets, martial arts, getting massages, reading, spirituality, cooking, dancing, golfing, gardening, fishing, hanging out with family, making sure you get good sleep. Rest is so important for our brain function. Sleep is so important. Only one person said that they use sleep as a self-care tool. And, I think that's great. You should get good quality sleep, but that really shouldn't be the only thing you do for yourself as well. Going on vacation, singing, playing with horses, hiking, photography, right? I mean, the amount of activities that are on here are just so tremendous. If anything, there was one person who said they're unsure. They don't know what they're doing for self-care. There's a couple of people who said nothing. And that's really in line with many healthcare professionals, right? You don't take care of yourself. You really are really good at taking care of others, but taking care of us is something that isn't part of any of our training programs. And so we're not exposed to it, right? And when we go to work, the pressures are on us. And it's always about doing more for patients, right? More paperwork, talking with insurance companies, meeting administrative burdens, right? Insurance regulations, legal burdens, clicking this box in the records, the electronic medical records, right? Along the way, there's everything about how do we get the business of medicine done? How do we get the healthcare side of things, the actual medicine side of medicine done? But there's nothing in any of our training programs, nothing in our career paths, nothing with our colleagues, where we really talk about self-care, right? Most organizations don't focus on that at all. So I am not surprised that people say unsure or they're not doing anything for themselves. I'm truly not surprised by that at all. But it is a scary thought, right? I mean, think about this. If you're a patient, right, and you're in dire straits, you're really sick, you need help, wouldn't you want your nurse and your doctor to be in the best shape possible to take care of you, right? Not to be burned out, not to be cynical, not to be depressed? Of course you do. Of course you do, right? So we have to be better at taking care of ourselves. And seeing all these different activities is absolutely wonderful because it really is the breadth of human nature, and that's beautiful to see. But we have to focus more on this stuff. We have to focus more on self-care. We have to take care of ourselves. Now, that's on the individual side of things. My other question was, of course, what resources does your organization provide you to take care of yourself for your mental well-being, right? And over half said there are no resources available. And again, this is very much in line with what you see really across the board with what my experience has been with the healthcare systems that I've been a part of. We really don't offer services to our employees to take care of ourselves. And that's terrible, right? We're running these healthcare workers into the ground, right? These systems are churning through nurses and doctors, right? And the data show this. We know this. And yet our organizations have no interest in taking care of us, right? The people that are providing value to the organization, the people that are actually the frontline healthcare workers that are taking care of patients, the people that are actually making sure money flows into the system, right? We don't take care of them at all. We don't care about them. And that is awful. That needs to change. There are a few people who responded with some things that are available to them. There's some very broad categories. Some people said, actually several people said employee assistance programs. And that's a very broad category, right? Most employee assistance programs that I am aware of, for the most part, deal with either financial strains or substance abuse. They don't really address burnout. They don't address mental and emotional well-being at all. Occasional group fitness classes, right? The word occasional there is key. Again, there's not good resources that are provided by healthcare organizations. And isn't that ironic, right? The very organizations that are providing healthcare are doing nothing about the health of their employees. Now, there's some, one person said BetterHelp. but with limited access. I think there were some limited sessions that were offered, and I've had some good and bad comments about BetterHelp. Some people have a wonderful experience, and some people have an absolute terrible experience with it. So I don't have any personal experience with BetterHelp. I really can't say anything for or against it from my own personal experience. But the fact that you have some access is a good starting point, but more still needs to be done. My biggest question that I really wanted to get at is, what do you think needs to change? What is one resource that you think organizations should add in order to help you, right? What do you think needs to change? And there's many different comments that I got. They're all great. But there are some themes that came about, I think, out of this data that I can share with you. So one of the things is, of course, providing support. We need to, as organizations, we need to provide support to our frontline medical staff, right? We need to be able to provide them with the right resources for not just physical health, right? We not just provide them with health insurance and dental insurance, but we also need to provide them with resources for mental and emotional well-being as well. Respect for time off, right? Limiting the amount of time we actually get to spend at the hospital. Taking care of other people can be an incredibly stressful situation, right? It takes an emotional toll on you. It takes a physical toll on you. It can take a mental toll on you. That's where burnout comes from, right? And so respecting the fact that people are not meant to stay at the bedside all the time, stay in front of the computer all the time and punch in data into electronic medical records and make sure the right boxes are checked on time, right? So respecting people for being people, other human beings, and that they also have needs and wants, and making sure that there is a good work-life balance available to them. Pizza parties was something that was mentioned by several people, right? Don't just give us pizza parties. I mean, I have so many issues with pizza parties. I mean, on the one hand, if you're providing healthcare, you probably shouldn't be feeding your healthcare workers pizza all the time. But aside from that, it also distracts from the fact that you really don't care. You're just going to the pizza shop down the road and get 6 pies for your unit, right? I mean, what does that really say? It just says you did something. It doesn't mean you actually care. It makes you feel good about yourself, right? The organization says, well, we gave them a pizza party, but it doesn't actually show any appreciation for what it is that these frontline healthcare workers are doing on a day-to-day basis, right? They're putting their mental and emotional well-being on the line for someone else, and all you're doing is giving them pizza once a month. That doesn't equate. Again, more resources for team building exercises, better access to mental and emotional health resources, limiting the amount of time that we're required to work. And the big one that comes up over and over and over and over again is limiting the administrative burden on frontline healthcare workers. And that rings just so true with me. Because I can tell you right now, I spend easily 80% of my time in a computer documenting in charts, right? All I'm doing is checking boxes and making sure the right words are in the record for billing so that the insurance can be billed, the patient can be billed, and money can flow into the system. Only about 20% of my time is actually spent at the bedside talking to people, right? That's not what I went into medicine for. I didn't go into medicine to be a data entry clerk. I didn't go into medicine to sit in front of a computer and punch the keyboard. Right? I went into medicine to help people. And how do I do that? Well, if only 20% of my time right now is spent at the bedside and the rest of the time is spent on documentation and the administrative burden that we've created in the system, that really doesn't fill my cup, right? So we have to reduce the administrative burden on our frontline clinical workers. And how do we do that? That's a terrific question, and there's no easy answer for this. But for one thing, and the one thing that I've said over and over again for years now is physicians have lost control of the healthcare system, right? With the advent of managed care, we have given over control of the healthcare as an institution to organizations. We have given control of the system to people with MBAs and law degrees instead of physicians. And we've seen this during the COVID crisis, right? We came up with all these policies and procedures that didn't come out of any data, right? There was no science behind it. It was just somebody saying, this is what we're gonna do now. And later on, when we started to have data on it, when we started to have some scientific evidence of what works and what doesn't work, we were so stooped in our protocols, right? That we couldn't change, right? we're still doing things, with COVID, right? That was so politicized that we really have gone away from the science of medicine. If you ask most physicians or most nurses about what actually works for COVID, as an example, the answers are going to be very different than what the organizations mandate us to do, right? Because it becomes so politicized. It's run by organizations, and there's good data that's been out there now for a long time. This is data that was presented to me in the late 2000s when I was going through medical school, that the cost of healthcare has gone up ever since we started adding all these mid-levels into it, right? All these MBAs. There's a linear correlation between the number of MBAs that are working in healthcare and the cost of healthcare. And just to give you an example, last week I had a patient in clinic who was complaining, every time I come here, doc, I get charged $500. What's up with that? And thankfully, his insurance currently is paying that bill, so it's not necessarily out of pocket for him, but obviously someone is paying that. But I showed him, CMS publishes physician reimbursement rates every year, and I showed him for what you're looking at, for this code, here, we'll look it up on the website, but we looked it up, and the physician reimbursement fee by CMS for that visit was $39.37. I said, look, you're looking at a $500 bill, I would get less than $40 out of that, right? Where the other $460 come from, I have no idea. And just to make matters worse, I'm salaried, right? So I get the same paycheck every 2 weeks. It doesn't matter how many patients I see. So whether I see 5 patients or 50 patients, I get the same paycheck. And so for me, it doesn't even matter that I only get $40 for that visit. In that sense. But on the other hand, it also means I have no incentive to work more than the minimum that's required of me, right? Because when I see 100 patients a week, I work more, I get burned out more, my mental and emotional well-being suffers, and yet the only person that reaps a financial reward from this is the organization I work for, not me personally, right? And the patient suffers too, because now I am more burned out, I become more cynical, and I don't even want to do medicine anymore. So that's just, I think, a great example of where the administrative burden in medicine has really taken a toll on the entire system, okay? Finding ways to reduce the administrative burden is going to be paramount to finding any sort of change in the system. And the one thing that we as physicians absolutely have to do in order to make that happen is to take back control of the healthcare systems. Right? We should be in charge of the healthcare system. We should be the ones that run the show, that make the decisions, that look at the science, and that make reasonable choices based on the available evidence. Not based on opinions from people who don't know anything about what it takes to be a bedside, to be a frontline healthcare provider. And that's really a big problem in the system right now. And that's not going to be easy to fix, right? That's going to take years and years and years. But the first thing we got to do as physicians, we actually have to take back control of the system. And unfortunately, right now, the trends are heading in the wrong direction, right? 2023 was the first year that more than 50% of physicians are in employed positions, right? I am one of them. So we're giving control over to the systems that way, because now I am told how to provide medical care, right? I am told what I can do and what I cannot do because I'm part of a larger organization, and they control the money, and so they control how care gets provided. I don't have control over that anymore. And that really needs to change. So we really need more physicians out in independent practice. And whether that's through private practice, being part of a physician group, or maybe doing locums work, right? But we have to get out of the employed positions as physicians. That's really important. Because that's the only way we can regain control, we can regain power, and we can change the healthcare system. Because once we have more numbers in private practice and more physicians actually back in control, that's when we can exert change. If the trends continue and physicians more and more are just going to be in an employed position, well, then being a doctor is just going to become another job. It's not going to be a profession anymore, right? And do I really want to spend 14 years in training to become a trauma surgeon, which I did, only to be in an employed position? No, right? Why would I do that? Why would I suffer through all those years? Why should I suffer through all the years of low pay during residency and high debt from medical school if the payout on the other end is just another job, right? That's really not what physicians are meant to do. And so we have to regain control of the healthcare system. That's the only way we're going to be able to provide any sort of change. And if you're looking for that change in your own life, again, I have medical career coaching packages available to doctors, trainees, right? Whether you're a resident, a fellow, and even students, to set you up for a successful career in healthcare. I have a package for nurses as well, right? There's some nurses that responded to the survey. So if you're interested in that, if you're frustrated with your current situation, if you're burned out, if you're looking for a change, whether that's for a career change within the healthcare field or maybe even transitioning out of healthcare altogether, please get in touch with me. I'll link the website below. It's a great place for you to find some more meaning and fulfillment in the work we do every day. But burnout is real. And if you look at the statistics, even amongst physicians still are the profession with the highest suicide rates in this country, right? Think about that for a second. Physicians are the profession with the highest suicide rates in this country. How does that make any sense? The people that are most capable of taking care of others have the highest suicide rates. And the systems we find ourselves in are no help. Quite the contrary, they actually make it worse. And so we have to make change. We have to change all of this. And let's get physicians back into private practice. Let's have physicians regain the power over the healthcare system so we can actually create this change to make this world a better place for all of us, so that patients have access to care and patients have access to good quality care as well in the process. All right, that's all I got for you this week. Quick survey results on the burnout survey that I put out. It's still up if you're interested in taking part of the survey, and get a free copy of the Phoenix textbook in exchange. The Phoenix program is also still up on the website, right? That's a program that I put together specifically to address burnout. The full video course is self-guided. You do that on your own time. That's on the website. The textbook is, of course, available. And again, you get a free copy of that if you fill out the survey. And there's also the mini course. It's 14 days, self-guided via email, completely free. Unsubscribe anytime if you don't like it. But that's also a great place to get started if you're completely lost and don't know where to begin. Super easy to do. Just name and email, put that on the website, and you get started right away with the Phoenix mini course burnout program that's on the website. And then, of course, if you want to go beyond that, these medical career coaching programs that I've put together, they're 12 weeks long, right? They're pretty intense programs. They talk about everything about your life. What's your financial readiness for your future, right? What's your work-life balance look like? How do your core values and purpose show up in your life and define what you do? How do you find meaning and fulfillment? What career options are available to you? And what we explore all of that in these 12 weeks together. So if that is something you're interested in, please reach out, check out the website. It's all up there. So that's all I got for you. Like I said, quick survey results. Keep up the good work out there. Fight the good fight. And I'm here anytime you need me to unleash your genius.